So I have made some important microbiology notes, that is of infectious diseases. So let's go through. So atypical pneumonia, what are the causative organisms? So in atypical pneumonia, it can be due to mycoplasma, legionella and psittacosis. So in atypical pneumonia, it is also called walking pneumonia because here the patients are just having flu-like symptoms. Moving on further, that is leptospirosis. So leptospirosis is due to contact with the vermins. What are vermins? Fleas, mice, lice, rats, rabbits. So here you can see the liver complications, thrombocytopenia, which is low platelet count, and acute kidney injury. Talking about bites, so in animal bites, if there is a cat bite or dog bite, so here you can have the most encountered organism in bites are Pasteurella multocida, and for this you can give the treatment with amoxicillin clavulanic acid. The clavulanic acid is penicillase inhibitor, that is the enzyme beta lactamase enzyme inhibitor. Okay, talking about if there is a penicillin allergy to the patient, then you can go for doxycycline and metronidazole. This can also be effective. Talking about the human bites, so the human bites mostly is a multimicrobial infection. Here you can have aerobic and anaerobic organisms like Streptococcus species, Staphylococcus aureus, Echinella, Fusobacterium and Prevotella. Talking about the cerebral falciparum malaria, it is caused due to Plasmodium falciparum. So here it is also a tertian malaria. You get a fever in 3 days interval. So here there is a cerebral malaria in falciparum. Cerebral malaria, it is a severe form of malaria, and here the patient can have seizures, coma. Here acute renal failure leading to black water fever, and there is a secondary to intravascular hemolysis. And talking about ARDS, that is acute respiratory distress syndrome, occurs in cerebral malaria. And hypoglycemia, disseminated intravascular coagulation. So it is the most severe form of the malaria. Talking about the shock, so in this malaria, shock usually do not occur, but if shock is occurring, means the patient is having other bacterial infection, so it can lead to septicemia and shock. So malaria alone rarely causes hemodynamic collapse, but if it is having shock, means the patient is having septicemia. This video will discuss about toxoplasmosis.